Welcome to the online nutrition class video series. In this session we will discuss post-op issues. First we'll talk about surgical bleeding, which can occur immediately after surgery. Slight oozing from the incisions is very common for the first 24 hours or so. If this happens, try to minimize your activity and apply some pressure to the area. You can change the gauze bandages if needed as well. If bleeding seems excessive, or there is blood in the stool, or you are vomiting blood, please call us immediately. Colace. Now let's address constipation, which is a common issue. This can be a result of a high-protein, low-carb diet. The first thing to do is to focus on complex carbohydrates and fiber, if appropriate for your dietary stage. We recommend starting with Benefiber, which can be used at any point after any procedure. If that doesn't work, you can switch over to Miralax. If you still have no results, you can add over-the-counter Colace, along with the Miralax. If you still have no results, try 2 over-the-counter Dulcolax suppositories. Please call the office if you still have had no bowel movement after all of the above suggestions. Please make sure you are getting plenty of fluids in, otherwise these products do not work well. It's important to note that it is perfectly normal to have no bowel movement for 3 to 5 days after your procedure, so only use these products if you feel you are constipated. Next, let's address bloating and gas after your procedure. Anesthesia and narcotics are known to slow your bowel motility down. Walking will help to stimulate the bowel and increase the motility. Some foods may make you develop unusual bloating or heavy gas as well. If you feel these symptoms, avoid those foods or cut your food intake until you have relief of these symptoms. You may also take over-the-counter medication for gas or bloating that can be chewed or that come in strips to dissolve on your tongue, such as Mylocan or Gas-X for the temporary relief of these symptoms. Next, let's cover vomiting issues after your procedure. If you vomit, you may have eaten or drank too quickly, too much, or the food may have been too solid. Wait 4 hours and then try 1 ounce of liquid that doesn't have any sugar. If this liquid does not make you nauseous or vomit, then take only liquids until the next day. Then you can try pureed or solid foods again, depending on the diet stage you are currently on. If at any time you have constant vomiting, or vomiting that looks black, bloody or like coffee grounds, this could indicate a problem and you should call the office immediately. Women should avoid getting pregnant for 18 months after any type of weight loss surgery. Rapid weight loss also rapidly increases fertility, so birth control must be used correctly and at all times to avoid pregnancy, even if you were not able to get pregnant in the past. A barrier contraceptive, such as a condom, diaphragm or patch, is suggested in addition to the birth control pill, as hormonal changes may alter the effectiveness of the birth control pill. We get calls from patients all the time who end up pregnant a few months after surgery, who didn't think they could get pregnant. So please take this seriously.